Hi, good morning, Desiree, and welcome. We're actually at the Robert Sobukwe Hospital here in Kimberley. That's, of course, the only referral hospital here in the Northern Cape. So you have patients that come from as far as Alexander Bay, which is about 1,200 kilometers from here to get services like, for example, oncology and other services that are not available at their local hospitals. But of course, what we've seen at this hospital since this morning when we came here is that people are actually standing in queue. Some of them have been here. When we got here, we saw a father who's been here since 9 o'clock last night. His son had sustained a burn wound, and he had waited from 9 o'clock last night and was only helped around 8 o'clock this morning, so a 12-hour wait for services. And that's basically what the health MEC we spoke to earlier this morning also had to say, because of the fact that this is the only referral hospital in the Northern Cape, and because they have staff shortages and infrastructure shortages, you'll always have that sort of situation happening. Of course, the health department, education department receiving the bulk of the provincial budget, and they've set aside more than 400 million for this financial year to basically start building more clinics and another district hospital to basically sort of relieve pressure from the Robert Sobukwe Hospital here in Kimberley. But let's talk to one of the patients who has been here, we've spoken to earlier, just to get a sense of what are the issues that they are grappling with. Sir, you spoke to us earlier this morning saying, tell us, how do you feel about the health services here in the Northern Cape? You access it regularly.
It's very weak. People must stay for 2 hours long to wait for to help the doctors. People must wait for long hours so that the doctor can help. It's very weak here. It's not good here to see that patients must wait for the ill helpness.
And what do you want them to basically do to assist you and the other patients here?
To get more doctors to must help them faster, and to get the patients of yesterday by other patients to build more, to make the building bigger and get more doctors to experience and something like this.
Thank you very much, sir. That is Martin Vance. He's one of the patients. Been telling me that he's been waiting here for quite a number of hours waiting for services, and basically that is the sentiment that we've been seeing even yesterday when we went out to talk to people about the upcoming mini budget and what they would like to see change within the budget of the health department. Is basically people saying that, if you want to access the health services, it's a day lost. And in some cases, not even 1 day, 2 days, because of staff shortages, where there are just people overwhelming the health services, not enough doctors, not enough nurses to basically assist, but also not enough places to go. So you have this facility, Robert Sobukwe Hospital, but there are clinics that are supposed to relieve the pressure, and district hospitals as well, but they are not functioning properly, either because of infrastructure problems. They like certain units are closed because of structural damage, etc., or they do not have enough nurses and doctors to basically assist the people that do come in to basically get to their services. Desiree?
Ulrich, what I do find interesting, particularly from the institution that you're reporting from, and the fact that the residents of the Northern Cape are complaining about low standard health services, is that this facility is fairly new. It's supposed to be providing proper service.
Well, this facility that we're broadcasting from at the moment is actually one of the older facilities in the Northern Cape. It's more than 40 years old, so you do have that type of thing. I think that the facility you are referring to is the SABC Hospital, state-of-the-art facility, again, Desiree, sitting at Uppington in the Northern Cape, about 400 kilometers away from here. And that was supposed to alleviate the pressures coming to this hospital. But again, that facility not being properly managed or properly optimally functioning because there aren't doctors available, there aren't nurses available. So you have this situation where people come from Springbok, you have where people coming from Alexander Bay and other areas within the Namaqualand, passing through the SABC Hospital in Uppington and coming here, instead of going there where there are the state-of-the-art facilities again. There are machines being in the hospital at the SABC that are not available in the Kimberley area, and apparently available in very few hospitals in South Africa that are not being used because basically there are not people who are able to use them, or there are not people able to use them because the specialized care or the specialized people who are supposed to do that is not there. Sorry, we're just moving away as they are bringing a patient in to the emergency unit here. But Desiree, the Embassy of Health in the Northern Cape basically also saying that they're hoping that within this budget that we are going to see being delivered by the Finance Minister at around 2 o'clock today, that he will have some sort of gap for them to be able to alleviate all the plans that they want to do. Like I said, like the shortage of health personnel, because they have been complaining since before COVID already that they are unable to take that pressure, and they have been wanting to basically get more people involved and more people employed, and to build more facilities for people to come and access health services.
Ulrich, thank you for bringing us the picture in the Northern Cape as we await that budget by the Finance Minister.